Open Your Eyes is brought to you by the Belize Bank. Our country, your bank.
Welcome to Open Your Eyes.
Start your morning right. I am John Palacio.
And I'm Marlene Cuellar, and thank you for joining us this morning.
Thank you so very much. We've got some wonderful conversations lined up for you. We look forward to it every day, but primarily what we do at first is that we take a look at the weather. So we'll be joining the forecaster on duty shortly to tell you exactly what to expect. The Christmas week, this is the Christmas week. We're just about 2 days out. It's Wednesday, Christmas is Friday, and everybody is excited.
And we got Francisca on the line. Good morning.
Good morning.
Good morning. Is
How
that
are
John?
you?
That's right.
Okay.
How are
John.
you today?
I'm fine, thanks. And how about you?
Oh, we're doing great. We're doing great. We're hearing from you, Francisca, and you're going to deliver us the good news about this wonderful weather that we'll be having. Right or right?
Yay, that's right. Yay.
So let's start into it then. The general situation, what should we expect or what is going on?
Okay, we'll have sunny skies, a few cloudy spells, and isolated showers.
All right.
You know what that means in Creole, right?
No.
Leave it rain.
And in the 24-hour forecast?
That's it. We'll be seeing sunny skies today, like I said, cloudy spells. Tonight, partly cloudy skies, isolated showers.
So if we'll be seeing Libita rain, we should be
That's
having
right.
some cool temperatures, right? What are the temperatures, highs and lows?
That's right. Along the coast today, we're going for a max of 84, inland 86, the Maya Mountain 74, and then overnight temperatures 77 along the coast, 72 inland, 64 up in the Maya Mountain.
Wow. The winds, though, from where?
From the east, 5 to 15 knots and producing choppy seas, 3 to 5 foot waves.
Sounds good. Would you say that's good?
Say that again?
Would you say that's good when you hear 3 to 5 foot waves along choppy seas?
Yes, because that 3 to 5 foot waves beyond the reef.
Oh, okay. So we should be smooth around here.
That's right.
All right, Francisca, we won't take much of your time. Tell us about the extended forecast. What should we expect in the next few days?
Okay. Tomorrow, Thursday, we'll continue to see isolated showers around the country. Tomorrow night, a cold front will cross us. And yes, and so we'll see just a slight increase in shower activity. So Friday morning, Christmas Day, we'll wake up to cool temperatures.
Wow.
I am so excited about that. I was hoping it wasn't going to change when they first told us. Now, is it going to be a wet cold front, though?
No.
So it's all cool temperatures.
That's right.
All right, Francisca, you...
Santa got everybody order.
Yeah.
We were all good this year.
Oh, my God. Yeah, he got all the orders. You know what? And everybody ordered some cool front.
Cool front.
All right, Francisca, thank you so very much. And, of course, we'd like to wish you all the very best for the Christmas season. You and your family, Merry Christmas, all right?
Thanks and same to you guys.
All right. There we go.
Okay, bye-bye.
It's always nice to chatting with the forecasters on duty. They tell us exactly what to expect. And like Francisca just told us, we should expect that when we wake up on Christmas morning, it's going to be a little cool on the chill side.
That sounds perfect.
Yeah.
All right, let's keep things moving this morning and get into some motivation to get our day going. That means it's time for Eye Opener. Our Eye Opener is taken from dailyom.com and it goes like this. Whether you choose to give a gift or share your friendship, remember that it is the intention behind the thought that is most important. The gifts we craft with our own hands are often the most significant because the love that drove us to create is infused in the products of our creation. And the recipients of these homemade offerings receive a token of our willingness to invest ourselves in their joy. If you love journaling, Share your writing joy with family and friends by giving each a unique, handmade personal journal. A simple spiral notebook dressed up with paper, fabric, photographs, or other embellishments will give your loved ones a special place to record their private thoughts. Erase the distance between yourself and your faraway loved ones by presenting each with a photo journal, documenting how your life has changed in the past year. A progressive photo album wherein pictures tell the story of your relationships from the past up to the present can be a reminder of the many wonderful experiences you and your loved ones have shared. Whether you choose to give a gift or simply share your friendship and love, remember that it is the intention behind the thought that is most important.
Yep, that is most important. Marlene, I really and truly love the eye opener, as per usual. I tell you that every Wednesday and Friday, and other days when I'm here. But it is not what you give. It's the thought that you actually give something. And I'd really love if we could continue to look at things from that perspective. Look, the fact that you wake up another day is a gift. The fact that somebody even thought about you is a gift. Giving to you something, it doesn't matter what the item is or whatever it is. From the mere fact that it comes from the heart and you in mind and thought, that is a gift. It's not what you give. It's the fact that you even have it in mind to give something. Today or this Christmas, we know that things are going to be tough for a lot of people. So for this Christmas, for me, I'd beg that at this particular time, don't watch the gift. Watch the thought that you're being given a gift, or they think about you giving a gift. If you think that things are hard, then the mere fact that you wake up, give thanks to God for the fact that you are waking up, which is a gift. That's how I feel, Mar.
Absolutely. You know, and I think that definitely we've seen people be so innovative this year with all the extra time.
I love it.
That many people have had on their hands.
Yeah.
And this is an eye-opener that really just pushes you to explore beyond purchasing something and giving that as a gift. You can always make something and give it to one of your loved ones. And really what you're showing them is, one, that you thought about them, and two, that you've invested your time, your energy, and your skill into providing that gift for them. It's really interesting. And I think everybody has different patterns for gift giving, and even in the expectations. The little ones always have their lists, and they're always the ones who have a very specific idea as to what they want.
Yeah.
And I find that shopping for adults, you know, you can go two ways. You can be very thoughtful, or you can also spend a lot on someone.
Yeah.
I love Christmas for this reason. We're not big in my family, we're not big in giving gifts all year round, you know, for other occasions. But for Christmas, it's the one time that, you know, you're spending time to think on what you're giving someone. And that really is the best part, you know. If you give me a list, I probably wouldn't give you something from the list, because I want to show you that I paid attention to something that you said or something that you were lacking in some way, and then give you that as a surprise, because that's the gift. The gift is that I paid attention and I care enough to be able to provide that to you.
I really love the way you summed that up. One of the things that the eye opener made mention of is, and it came to mind, that if you're talented in some way, shape, or form, which of course all of us are, some of us might think otherwise, but if you're a comedian, share a smile. You know that when you laugh, you know, it's a part of your health. You know, so things like that, and I really and truly, especially for this year, and I continue to say it, Mar, that this is one of those years that, man, we didn't expect it, but at the same time we're sticking in there, which of course is a gift to us, and I really and truly hope that people could actually see it that way. Out there, though, if you take a drive around the city, Marlene, you took a drive around the city?
Yeah.
My goodness.
I think today and tomorrow is probably going to be even busier.
But you know, at the same time, there are people out there who are trying so hard to try and get some stuff for their family. But primarily, guys, let's be safe. Let's do this in a safe manner. You know, let's continue to adhere to these rules and these you know, practice your social distancing, wear your mask. We want to get a few things, but let's do so safely. All right, and everything is going to be A-okay.
All right, so don't beat yourself up over those presents. You know, you can always make something. I think those are some of the most thoughtful gifts that you, especially, you know, when the kids give to the parents and they make it. Oh, that's the best.
Oh my goodness, when I get home and I have a note that says, Daddy, I love you, or Mommy and Daddy, we love you, and oh my goodness, you want to even cry because it's so thoughtful.
Doesn't every parent have like a drawer of, like, you know, handprint Christmas cards?
There's a folder, you know, but it means so much, Mar, because it came from their mind, and it's simply because you're teaching them how to love from a note. You know, and those things are beautiful, man. I love it. I love it. Right. That was a great eye-opener, though. And for today, we have 3 lovely conversations for you, like we always do. So, again, we want to thank you so very much for joining us. We'll be kicking things off this morning with, of course, our COVID-19 update, courtesy of Full Tech Systems. We'll be talking to Dr. Hidalgo, Dr. Jorge Hidalgo, who is an internist at the Belize Healthcare Partners, and we'll be chit-chatting about the new COVID variant in England. Wow.
Yeah.
That's tough.
So that's been kind of a buzz topic. So we wanted to get a better understanding as to what it means. And of course, we're going to rely on the medical professionals to be able to provide that. So Dr. Hidalgo will be helping us understand what it means.
Of course. In our second segment as well, it's going to be a review, though, of the Salvation Army's activities for 2020 and their Kettle Appeal fundraiser. Whenever you go to certain stores, they're right out there ringing a bell. Yeah. And it is for a worthy cause.
Yeah. All right. And to close off for today, you know, I thought that we'd covered everything for Christmas meals, but we didn't.
Really?
No.
Why?
We forgot something else that's really important.
What is
Don't
that?
you enjoy at Christmas time a nice slice of plain white cake?
My favorite.
With a slice of ham, right?
With a slice of ham.
That's right. That's the way to have it.
On Christmas, cake, you can't have cake without ham.
That's right.
That's just my thought.
So today we're going to be tackling that plain white cake. It's simple, but it's a lot more complicated to make than people think. So that's going to be our closing segment for today to get you ready for the Christmas. We're going to take a break, but before we do,
we've got to say happy birthday, as we've got our birthday shout out to none other than Aisha Bab. Happy birthday to you. Looking lovely. Here is wishing you all the very best, coming from the family, from all of us right here at Channel 5, and all of us right here on Open Your Eyes. So we'll take the break. When we come back, we'll get right into the conversation. Stay with us. We'll be back.
In these challenging times, the one thing that is certain is that the Belize Bank Limited is here for you. There is nothing more important than your health and safety, and we continue to make every effort to make banking safer for you. Our staff is working around the clock to make sure you can do your banking conveniently 24/7 using our mobile banking app and online banking and keeping ATMs up and running. We value your relationship with us and are here to provide the support you need. First responders are also out there 24/7. Thank you, healthcare workers, security forces, firefighters, caregivers. You are all appreciated. Stay safe. We will get through this together. The Belize Bank, our country, your bank.
Smart got you this December with the We Kinda Christmas promotion. Starting December 4th, you can avoid the rush and be safe while visiting our showrooms to get these one-of-a-kind deals.
Devices start as low as $70 with the Evo Star Mobile. Other devices like the Nokia 2V for just $165, Motorola E6 for only $235, and Samsung A51 for $675. Check this out. The first 10 persons to purchase any of our iPhone 7s get 50% off that device. Each device comes with 50 SMS, $10 promo credit, plus 2 gigabytes of data, all for free.
Looking for tablets? Then take advantage of the Amazon Kindle 8-inch for $155. Or get a Samsung Tab A10.
All phones come with a starter pack, free SMS, credit and data, plus an extra Christmas treat of 2 gigabytes data, a package valued at over $27 for free.
Now this, that's we kind of prices, and you can only get them at Smart.
Why, Tony?
Boy, kid, what you going on, man?
We actually can see we can need to buy a stack of them plastic plates and cups from the grocery shop because I run low.
Boy, I stopped importing that thing since April 15th, you know. And I just ran out to the last batch, must be about like 3 weeks back, you know.
Man, do I usually have anything? What is going on?
Check this, right? That's the new law, we ban all single-use plastics, so that the cups, plates, forks, spoons, and knives, all of that. Since April 15th, can't import none of them. Starting January 15, 2021, you can't manufacture them. April 15, 2021, you can't sell them. And after July 14, 2021, if you get catch with any other thing, you will get fined.
Me never know this. I guess I have to make some changes then. I have to make the customers know that anything not available. Anyways, bro. Thanks, man.
No problem, man. Take care.
With all the changes that 2020 has brought upon us, this holiday season is unlike any other. But despite all those changes, this year has taught us that being apart doesn't mean we can't stay connected. And that's why here at Channel 5, we adapted to keep you connected with relevant and reliable information and entertainment, as we've done for the past 29 years. And so as we move into the new year with new norms, we promise to continue being here for you through it all. From our family here at Channel 5 to yours, we wish you health, peace, and happiness this season and beyond. Merry Christmas and Happy New Year.
Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price but stay for the service.
And welcome back to Open Your Eyes, and we're now moving into our first segment for the morning. Of course, this is our COVID-19 update, all courtesy Fulltech Systems. The conversation will surround the new corona, or actually COVID variant in England. We'll be getting a breakdown of this. We've got in with us Dr. Jorge Hidalgo, who is an internist at the Belize Healthcare Partners. As a matter of fact, he's on the screen, a very good friend of ours. Doc, good morning.
Good morning, and thank you for the invitation. It's a pleasure to meet with you guys.
Definitely. We want to welcome you, and there are things that's going on that a lot of folks would like to get to know about when it comes to the coronavirus. And of course, things that we'd like to get clear for the public to learn, to know, so they know exactly how to take care. Let's firstly jump on into the new corona or new COVID variant in England. What is this?
Well, as you know, the headlines, as everybody knows, is essentially talking about the new variant of the SARS-CoV-2 that appears to be more contagious. Based on mathematical analysis, they say that probably is 70% more transmissible. and essentially it's due to a mutation that happened not in the recent days. Actually, this was identified in September, no? But of course, it's now in December that we see a number of these type of variant, and of course, it's causing a lot of alarm and make as everybody knows and is aware, the government of UK to take some very drastic measures, like essentially restrictions for Christmas. And you see some of the neighbor countries are essentially banned travel from the UK, and some of them basically close the borders. No, in that just to put it in perspective.
Before we dive deeper into the new strain that was detected in the UK, let's step back and talk about viruses itself and their behavior. Viruses would normally mutate. It's part of what they do that makes them difficult to treat. Do you want to explain that, Doc?
Yeah.
Yes, I think so. That's probably one of the most important things we need to know. One of the aspects of the coronavirus is that the coronavirus is an RNA virus. And if we want to understand the RNA viruses, normally they are in the terms of the measurement, they are basically say that 10 to 12 kilobytes in the size, I mean that normally those are small. Coronavirus, and especially this SARS-CoV-2, have an important characteristic. It's a very big virus. It's more or less between 25 to 32 kilobases. I mean that can you imagine how huge is the virus compared with the normal RNA viruses? And if we say that this virus is that huge, then we can imagine that this virus has an ability to mutate. And if we follow the normal trend of RNA virus mutation, we say if a virus of that size mutate at that speed, then essentially we say it will mutate and it will kill itself. It will commit suicide. It's not going to survive. But this coronavirus have an ability to control his mutation. It's a very, very smart virus. No? It controls his ability to mutate. I mean that when we also a difference of the DNA, the RNA viruses don't have this ability to proof reading, and also don't have the machinery to correct some of the errors that they happen when they mutate. And when we talk about mutation, essentially what we are talking about is a change in the code of the virus. The virus changed his mutation code, and of course that happened in all the time. In a replication, we want to mention that they replicate all the time and they are mutating all the time. It's nothing strange.
Yeah, so it's similar if you think about it. It enters our body, it attaches to our cells, and then it starts replicating. And
that's correct.
And in that process, as when you make a copy of a copy of a copy of a copy, there are changes that may happen that weren't intended. Now, what has been identified in the UK has been a new strain. But would it be safe to say, Dr. Hidalgo, that in fact there are many other mutations out there of SARS-CoV-2?
Yes, we say when we talk about the changes on the genetic code and the mutations, then we essentially we say where or how we are going to compare with, and we want to compare with the original Wuhan virus that as a coincidence it was identified, at least described in December a year ago. No? However, when this virus started to affect Europe, we already see some mutations. No, probably not as bad as this one, but then Normally, this coronavirus or any virus is going to mutate. Some mutations essentially don't make the virus survivable. Some other mutations happen but don't have any impact. It's just essentially one or more statistics of the mutations of the virus. But what is exactly is going to happen is in one of the mutations is that it will provide the virus with certain capabilities of certain abilities, and that is happened with the virus of that we are the variant that we are seeing in UK right now. That what we are seeing is that is essentially giving this virus the ability to be more transmissible. There is estimate based on mathematical calculation that is 70% more transmissible, and if it's more transmissible, then we have more cases, and especially in this particular time of the year that there are more gathering, then that's essentially facilitate and to see more numbers of cases that we normally see. And of course, if we see more cases, then the possibility to have more sick people and also to get the hospital more busy is the main concern.
You know, exactly where I'd like to go here, Doc, is a further breakdown. When you make mention of, okay, it's 70% transmissible, and people are, and folks are, let's say we are adhering to the rules, we're washing our hands, we're wearing our face masks, socially distant. Of course, as long as you're socially distant and you're not in contact with somebody with the coronavirus, of course, your chances of getting it is very, very low. But when you say 70% transmissible, can you break that down more? We're trying to understand, okay, 70%, but we're trying to do as much as we could not to get this. 70%. Yeah. Tell us more about that.
Well, essentially, as we mentioned before, when this virus mutates, it offers the virus certain advantages. I mean that, in other words, we can say that if it's more transmissible, that means that probably in a regular situation, we say that the virus is going to be more transmissible only if you cough. But in these particular circumstances, we can say that the virus is going to be more transmissible only just with having a normal conversation with someone.
What?
I mean that is one of the things that we are seeing, and also that we are recommended. We need to have more. We need to more space on that. We need to be more strict with our social distancing measures.
Yeah. Doc, how is the difference in the strains identified, and does Belize have the capacity to find out what strain we do have present in our country?
Well, to put it in perspective, when we have this mutation, and particularly the mutation that we're seeing in UK, we've seen that there are 70 different types of this mutation, 70 to 23 different types of this mutation, but two are the most important one. Essentially, the mutation is affecting the most important structure of the business, if we can say that way, of the virus, and is the spike protein. I mean that one of the mutations essentially change the spike protein and make, in a sense, that have more affinity to the regular cells that normally affects our body. I mean, we are going to be more easy to get infected. The other two, because there are two of them that are more important, is a deletion on the genetic information. That means that there are probably miss of the piece of the genetic code. And then what happens if it's the case is that essentially in a normal circumstances, when we have this virus and then the body produces antibodies to fight the spike protein, we notice that this is with this deletion, then despite the virus have the ability to resist that. And how the scientific community in UK noticed that is that when they start to administer the convalescent plasma in some of the patients, they noticed that it didn't work like in other situations. That they found that something is happening with these patients, and then they realize that is one of these variants that it make resistant to the patients, or at least to make resistant to the normal ways of treatment. In that case, in this particular case, is the convalescent plasma. Yeah. Mean that, as we mentioned, the variant was recognized in September. No? We don't know if one of these variants are already in the U.S. and probably eventually in Belize. We don't know as yet. We definitely need to be more vigilant as what is happening, and more vigilant in terms of how our patients are behaving. If we notice that that's something different that we are seeing before, then probably it's something alarming, and we need to report it. No?
So that's a key point. Even without doing the genetic coding required for us to know what strain is in the country, doctors like yourselves that are treating COVID patients can see changes in patterns of severity, in aggression of the illness, and kind of get an idea that there's something different taking place. Is that what you're saying?
Yes, I mean that in our clinical practice, when we are seeing a patient, by now we must have an idea about how our regular patients is going to behave. You know, we have an idea. Okay, we see already from, as you say, the first case was already detected 9 months ago.
9 months ago today.
Thank you for that information. And then if we can say, okay, let's go back to 9 months and what we are seeing in the last couple of months, and then suddenly we notice a different pattern on the behavior of these patients, then it's something that, based on the information we have, it's something that we need to call our attention, and also we need to inform the authorities that we are noticed that patients are becoming more aggressive, they are not responding to the normal treatment that we are offering, and probably we see more sick patient that we are seeing in the months or weeks before.
So naturally that prompts the question, have we seen any changes in the way we've seen people with COVID-19 so far?
Well, we are basically a week ago we was discussing a case that we see that in a couple of days we noticed that the changes in X-rays were more aggressive than we are seeing before. Previous to know that the information we have about the UK variant, and that's also call our attention, and we are discussing that among us, and to of course to be more vigilant on the new cases we are receiving in the different COVID units.
Dr. Dago, what would it take for us? I mean, how would Belize do that investigation to know what strains exist? Do we have to send samples out? Are there agencies that would assist, labs that would typically partner for things like this?
Well, we are partnering with Baylor College, you know.
Yes.
And we essentially what we need to do is we need to analyze the sequencing. The other countries, they have the capacity to in a group of patients, they are analyzing and sequencing the virus on a regular basis to essentially notice these variants. No, as probably you know, also the similar UK variant also was identified in South Africa. No? Then we are not completely certain, and they are not completely certain that was related with a a traveler or UK traveler, but is essentially something that happened independently and is already identified a similar strain in South Africa. I mean, that is not strange that that also we are going to see independent variants in our countries, or again, as I say, that we probably have a visitor that came from September to now, and eventually we see this type of variants. But back to your question, how we will know? We need to sequence each the virus and trying to see analyze the code of the virus and trying to identify these variants. No, we don't have the capacity, but we have our agencies that they are collaborating with us, that they are willing to help us with in case we need to send some samples to analyze.
Yeah. Do you think it's good information for us to know?
It's important to know because, of course, that way we can see what to expect with our patients, and also most important than anything, and I think so that the government is already taking some precaution, or we some measures with travelers that essentially that are coming from the UK. They must bring a PCR, a negative PCR, and probably they will ask to quarantine. I mean, those are some of the strategies being discussing right now. So what are the different measures that it will take?
Just one more on that point. While this new strain of the coronavirus of SARS-CoV-2 has been identified in the UK, one of the things that will naturally happen is that we may just tie it directly to just that country and people from that country. But Doc, can you put it a bit into perspective? Because they identified it, does it mean it originated there? Does it mean it's the only country that has this very infectious strain? Should we be cautious about everybody or focusing just on where it was identified?
No, as I mentioned in the very beginning, it's a natural situation that happened with the virus. The virus all the time, it will replicate. And then we will see mutations. It could be that the mutation happened in Belize, or the mutation happened in the mutation that give the virus certain advantage. As I mentioned before, mutations happen all the time. Some mutations essentially don't give the virus the ability to grow and simply disappear. Some other mutations happen, but just are a statistic number from the virus. And when we have this analyzing groups on screening, then we notice, but don't have major problems for the population itself. But in this, there are certain mutations that confer certain advantage of the virus. In this case, give the advantage of transmissibility. So it could be that also it make the virus more deadly. But when we have these cases that a virus that is more deadly, like the Ebola, don't give the capacity to spread too quickly. No? I mean that the coronavirus is in between. That give it could be in this case particular more transmissible, and also it could be in some scenarios, some mutations, it could give other advantages to the virus. But in this particular case, is transmissibility and can occur in any country. It just happened that they analyzed the sequencing, recognizing in September, and then realized in December that this particular variant, it became dominant. What that means is that is this variant that is more transmissible essentially take the place to other peers, now other virus that they don't have this ability. Then this virus, it became dominant, and what is the concerning part is that it can change the dynamic of the pandemic. And that's essentially our main concern. It can become the change the dynamic of the pandemic. We will see more cases, and then if we have more cases, then also the virus have the possibility of mutate
even
more
further.
easily.
Yeah,
right,
yeah.
exactly.
Yeah, but Doc, so while we study these viruses, we must study as well how we could get rid of them. There are vaccines now that we're seeing coming to light, which of course gives some hope to the world. So there is the new COVID variant in England. Are they saying anything about if the vaccines will be useful to getting rid of this one?
Yeah, when we talk about vaccines and also how vaccines can probably become the immunity is not going to be as effective as normal. Probably the better example is influenza. As you can see, influenza have every year have the ability to change the protein scheme, and then and it became resistant to the vaccine that we used the last year. And then that's why in the influenza we see that every year we need to change the vaccine.
Yes.
But it doesn't happen just like right now. It happens over the time, and then we have several variants of the influenza, and based on that we analyze statistically what is the variant of the influenza that is going to affect 2020. And then based on that, we say, okay, then based on that information, we decided to produce the vaccine that we statistically, we will know that is going to affect in 2020. But this vaccine is not going to be effective for the influenza season in 2021.
Wow.
But all this, it became over time. I mean that what we say right now, the question is the vaccine that we are using right now and then is not going to be effective with a new variant? The answer is no, at least, and then we can categorically say no. Of course, it's a possibility that we see some resistance, but immediately, based on how things happen, we can say that the vaccine that we have right now, who is the Moderna and the Pfizer, and it's based on RNA technology, who is a new technology, then we say that have also based on the spike protein, then we believe that, or we are certain at this point that the vaccine is going to be effective.
Yeah. Interesting information you're relaying to us, Doc. But I'd like to bring it back here at home. We're seeing a trend here at home, as a matter of fact, over the past few days in terms of the number of recoveries to the number of infections, new infections that we're getting. What are you seeing with this trend? I think yesterday the information we got was, I think 130 something, I'm not sure, in terms of new cases, but over 300 recoveries. Are we going in the right direction in dealing with this coronavirus here at home?
Well, as you know, there are many efforts that are putting in place, and that they are going also to put in place to mitigate what we are seeing right now, and also to control the surge of the cases. Basically efforts are being are going to be put in many directions, trying to give resources to the hospital, trying to also create awareness to the public, because probably one of the most important things is trying to bring the awareness of the population, and especially in this season. Remember that we see this increase or surge of cases after the elections, and also in the U.S. after the Thanksgiving. Then now we have Christmas, and then some of the measures are essentially to try to reduce the gathering that we normally do and then probably we want to see our loved ones as many of us we would like, but this time is a particular time, and then this time is to save lives. No, as much as we would like to be together with our family, we need to realize that it's not the best moment, no? And also is essentially to save lives, and then we need to try to reduce that. Many of the efforts are putting on create awareness to the public and insisting on our social distance measure, no, along with other measures, essentially revising the existing protocols, trying to put in place new protocols. As you know, the protocols of treatment, the different type of protocols need to be visited with very often. No? I mean that we are going to put in place some protocols now, but those protocols need to be visited in 2 or 3 months, because as you know, the pandemic and the coronavirus is very dynamic, and then we need to move based on that. We need to see what is the trend of the virus at this point, and then based on that we need to say, okay, this is time to change what we are doing in this direction, because the direction we are going probably is not working.
Yeah. And I think that's such a key point, because in being able to understand several things that you discussed this morning, one, that the virus has been mutating since it left Wuhan, China. It has, in fact, this particular strain has been identified in the UK and become the most common strain that they're finding, but they're also finding it in other places. It is, as you said very clearly, more transmissible, which means it's easier to catch or easier to spread than other strains that they've seen before. And I think it's been clarified that it isn't necessarily causing more severe illness, but more people are getting sick. So when you put that all into perspective, Doc, what is going to be perhaps the significant change that comes with this new detection? How does this change your minds, or perhaps looking forward with policies that this new information will impact?
Well, it's been already impacted, because as most of the effort that we are putting, especially in England, is to mitigate. Yeah. I mean that is, as you saw, they are essentially tightening their restriction for Christmas, trying to avoid massive gatherings, because of course that's the most important thing. Yeah. The spreaders. No, we know that when we have meetings, then this is the massive spreaders for the virus, and we need to avoid that. And that is precisely also we are some of the things that they are doing. We put it in place some restrictions to reduce huge amount of the gathering of people, especially to reduce, to mitigate and to limit the spread of the virus, and also to contain what is happening in our countries, and as well as some of the measures that we are going to put in place concerning people coming from the UK.
Yeah. And we've seen as well, I think if you just look at what's happening in the UK at this time, just kind of the rapid change of their own regulations heading into Christmas. They relaxed and they got stricter, all with the knowledge of what this new strain means. Do you think that will also have a global impact, that people will start reassessing how strict their regulations are? You noted before maybe even social distancing protocols may change.
Well, what is the message that we are having and we're seeing is that it's something that we know that is going to happen. We knew that the virus is going to mutate. Mm-hmm. The only thing, as we mentioned, we don't know in what way the virus is going to mutate. In this case, it's more transmissible, but in some case, cases, it could be that the mutation is going to be more deadly, or the virus is going to be more reproducible. I mean, the virus is going to mutate, and it will continue to mutate in several ways. Again, in the mutation that is going to happen in the future, we need to see what is the advantage that the virus is going to have. Right now, we know that the advantage that this virus has with this mutation is that it's more reproducible. Yeah. Mean that what essentially the message that as a medical community we have, that we need to be, and also as the public in general, is that we need to be more vigilant at what is going to happen. We need to be more vigilant in the different things we do. Is going to change anything in the terms of our social distancing measures? Is going to be essentially, we need to be more, we need to realize that what we are dealing with is in a very, very dangerous virus, and that we need to be very, very conscious on what we do as as a general persons. We need to reinforce, and we need to be more strict with the social distancing. We are repeating it every time, but unfortunately, despite of what we say, we encounter many people that they are not wearing the mask properly, or they are not essentially follow the social distance measure appropriate. And one important thing that we've seen is that if I got the virus, if I got COVID-19, some people have the belief that they probably are not going to get infected, and then they decided that they don't want to wear the mask, or they don't want to follow the social distancing, and that is a mistake, because the virus that we know is probably give you an immunity of 2 or 3 months the most, and we are not certain about it. Then after that, you are able to become reinfected again.
Wow.
Is it with mutations of the virus? Is it like some other diseases where you may get one strain and then can immediately catch another strain? We know that with example for dengue, you get dengue, one kind of dengue, and then you may get the other dengue the next year.
Same thing with coronavirus. You can you can become reinfected, and then now with the ability to mutate also, we know that we need to understand how it's going to affect the immunity, because again that's the ability that the virus have, it's going to interfere with immunity.
So let me just, and I know I'm going to ask you to speculate here, let me give that as a warning. Do you think that we have a more transmissible strain of COVID in this country? Because if we really look at the numbers, Dr. Hidalgo, let's go back to August. We had somewhere around 30 cases. We're over 10,000 at this time. A month ago, we had a little over 100 deaths. Now we're over 200 deaths. Do you think that it is possibly something about the virus, or do you think it's human behavior?
Well, I think so. It's a combination of both. The virus is as we know, have his own ability, and also unfortunate, as is being said, this fight or the war against the virus is basically is going to be win not for those countries that have the more resources, but for the countries that have more discipline. And I think so. It's a combination of things, and we need to be more, as a population, we need to be more disciplined, and we need to do our part.
Yeah.
As we know and we see, we are dealing with a very, very bad virus. We are not dealing with something that is easy, and also as you see, those countries have all this amount of resources. We have limited resources. That mean also make us to realize that we need to be more cautious, because if we are having a situation that we have an incredible amount of cases, our health system is already overwhelmed, and then we don't want to do the things to get in a situation that we are going to be in the capacity to help.
Yeah. Dr. Hidalgo, thank you for helping us understand a very highly technical issue with the mutation of viruses. And it is important for us to understand, because we can't think that it's just happening there. It's just we don't collect this data in Belize. We can't process it. So we need to know that this is possible any part of the world, the type of mutations that we saw in the UK. I do want to take a moment to say that I know you and your team at the COVID unit at Healthcare Partners, as well as facilities across the country, are probably going to be working over the Christmas holidays. Thank you for the work that you do, and we do appreciate all our frontliners and the dedication that they have been putting in. And while you more than likely will be working this Christmas, we do hope you have some time to spend with your family as well.
Yeah.
Thank you very much for the invitation, and you guys have a good holidays and with the family as well.
All right, thank you so very much. There we go. We're about to take a commercial break, but when we come back, we'll be talking about a review of the Salvation Army's activities for 2020, and also chit-chat a little about their Kitty Kettle Appeal fundraiser. So we'll do that when we come back. Stay with us.
This COVID update was brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service. Technology is ubiquitous, and it's transforming how, when, and where we work. Fulltech Systems is placing award-winning devices in the hands of information workers, allowing them to work without compromise in a world without wires, to innovate, create, and to maximize productivity anytime, anywhere, satisfying the needs of the desk-centric remote and field worker and every other worker in between. We are providing the industry's best devices to businesses going through the process of digital transformation. Partner with us today to provide the solutions that will allow your employees to work effectively and efficiently to enhance your customers' experience. Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.
Last year Christmas, we gathered in groups with family and friends, went shopping and spent time together in crowded spaces. If we do this during the COVID-19 pandemic, however, we'll help the virus to spread. Most of us have a family member who's elderly, or young but obese, or who has high blood pressure or diabetes. And while we want to hang out with them this Christmas, to stay safe during this holiday season, celebrate with only the members of your household, meaning the people who live in your home. Even though we have family and friends who would not want to harm us, inviting persons from other homes increases the risk of being exposed to COVID-19. Of course, we still have to wash hands frequently and wear a mask that covers nose and mouth consistently. And remember, if anybody is sick, if anyone has a cold, stuffy nose, cough, fever, or just feels tired, that person should stay home. A message from the Pan American Health Organization, World Health Organization, European Union, and the Ministry of Health and Wellness.
Every day, young persons are infecting older and high-risk family members and friends with the COVID-19 virus. This Christmas could become the super spreader event we've all been afraid of. The end result is suffering and a horrible death. Please, do not let a couple of hours of fun cause a lifetime of mourning and pain.
Practice physical distancing, wash hands often, and wear your mask properly.
Staying home this Christmas will ensure many more with your loved ones in the years to come. A message from the Ministry of Health and Wellness.
changes that 2020 has brought upon us, this holiday season is unlike any other. But despite all those changes, this year has taught us that being apart doesn't mean we can't stay connected. And that's why here at Channel 5, we adapted to keep you connected with relevant and reliable information and entertainment, as we've done for the past 29 years. And so, as we move into the new year with new norms, we promise to continue being here for you through it all. From our family here at Channel 5 to yours, we wish you health, peace, and happiness this season and beyond. Merry Christmas and Happy New Year.
welcome back. Welcome back to Open Your Eyes. We're now moving into our second segment. And in this segment, it's going to be about a review of the Salvation Army's activities for 2020 and also their Kettle Appeal fundraiser. Now, into talk to us about it is Major Jonathan Kelman, who is the District Commander, Salvation Army Belize. Mr. Kelman, we're seeing you. Good morning.
Yes, good morning. Good morning to all of Belize.
Thank you so much for joining us.
Yes.
It's almost like Christmas tradition here at Open Your Eyes that we make sure we do our check-in with the Salvation Army.
That's right.
Most certainly.
Yeah, I have to say though, the Kettle Appeal is ongoing. I made some stops in the past few days and I saw the kettles out there. It's a part of our soundtrack for Christmas.
Yeah.
We got to hear that bell and we know that it's Christmas time. But I never thought about what the impact of the pandemic would be on your appeal and how you may have had to adjust or how people are responding. Do you want to talk about that as we start the conversation?
Yeah.
Yes. Thanks for inviting me this morning again. And really and truly, as you keep hearing, this is a new normal. And we have had to make so much adjustments this year that we were uncertain, first of all, whether we were going to be out there during the kettle because of the COVID restrictions and so, and contact with people. We were not sure whether we were going to do food hampers. So many things were unsure that we actually literally started 2 weeks after the time we would normally start, and we didn't even have an official lunch. So even though the appeal may soon be finished, we haven't actually officially started. We just started. We have noticed a reduction in some of the income from the kettles because some people are unemployed because of people working at home. They haven't been out there to make the contributions. So we have seen that. But I also would like to say that there are some people who have, as you say, the Salvation Army is Christmas is not Christmas without the Kettle Appeal. People have made a contribution, a decision to make their contribution an annual thing. So we have had people coming into the office to say, well, we haven't seen the kettle yet, or we haven't received a letter in the mail from you requesting support this year. So we have brought in our contribution to the office in advance. And when that started happening, that propelled me to really get out there, get some volunteers, reduce the locations, get some volunteers, and send the letters out, because I really the public was waiting, still getting ready to partner with us this year.
Yeah. You did mention, or before I go to that, Marlene is right. Listening to those bells when you go to specific stores, you actually do get that feeling of Christmas because of those bells and the fact that giving is actually a gift. So you're going out there and you've got some change. You know for a fact that once you're making that pledge or you're making that donation, it's actually the gift of giving. And so we're thankful for that. You did mention, however, that this is not a normal year. And it seems to be our new normal, which brings me to ask the question, how has 2020 affected your work at the Salvation Army?
Well, we are interwoven into the fabric of the society in many ways. There is a slogan that you may see sometimes online or other places. It says, where there's a need, there is the Salvation Army. And if we are not helping some person with disaster response, we are helping with flood or fire victims, we are helping in our education system with the primary school, we're helping with the food pantry, now known as the grocery bags. We're helping with our monthly welfare program to seniors, and also with recycled clothing and looking after the clothing for the homeless on the street is a number of things where we'll pop up. And so therefore when the COVID really kicked in or cases started happening and they started to bring the homeless off the street, we were involved with a group of people from Wellness Resource Center, Red Cross, other agencies, so many, NEMO and the City Council, Health Department, a number of agencies together to help house them at the MCC grounds and see them on a daily basis 3 times a day. We also had more residents coming into our Gans Resorts and Raymond Parks and that shelter. So we had to raise the sanitation procedures even more at these locations and try to protect ourselves. Now the food pantry program got enhanced to match the food assistance that the Ministry of Human Development was giving out. So packages went from a small thing with 5 pound commodities each to 10 pounds. So then my staff was working from that time until now consistently. So while people were working at home, we never stopped. And even more intensity, all staff of the Salvation Army were heavily involved in one aspect or the other. And we had to be really, really careful because of the small amount of staff and because of our involvement in so many different areas of social welfare. We had to ensure that none of us, and pray that none of us would get infected, because if we had, then we would have had to close some of the programs. Now the pantry, we have a client base of over 13, almost 2,000 clients, families. So that would have been very impacting. But we have seen more and more people come in individually for help and assistance because they lost their work. I mean, from every district in Belize, and it has been a strength to be able to assist. But we thank God for helping us. That's why I call it faith-based, because we don't usually have much support at the point some person comes through with a donation right in the nick of time.
And I thought of how the pandemic may have reshaped your outreach, but I didn't expect that particular response. So where you are seeing not as much contributions coming in because you don't have as much access to the public as well, but you're seeing an increase in number coming to ask for assistance.
Oh yeah. I would make this appeal, because we hardly will be out there saying, help us, donate to us or whatever. But we have been here for 105 years now, just working through serving the people of Belize. And people who have been impacted over the years try to find a way now to give back to us. So throughout the year, we are here to receive contributions. Now we see sometimes people bring clothing or furniture, this kind of thing, and we recycle that, and people can get it at a very, very low cost. So there's a spin-off industry for some people from that. But also then when folks come, their house is burnt down, we can bring them in privately and they go through the stocking and they leave all set. We were actually able to, because we had some left back from the hurricane, person house burned down, and they left with the tabletop stove and the gas bottle.
Wow. Are you finding, is it big families? Is it people who have lost jobs or people who aren't making as many hours? I mean, there are people that you always work with, communities that you may always work with. Tell us a bit more about the stories behind the people who are now turning to the Salvation Army for help because of the impact of the pandemic.
Well, there we actually reached as far as Orange Walk. we took a restaurant up there to a village called Douglas.
Yeah.
I received a message from a resident there on our Facebook page, and because the person wasn't in contact, I missed the message for like 2 weeks. And when I read the message, the person actually sent me 30 pictures. So it was very convincing. And I said, boy, we have to get up there. But remember now, this is Orange Walk and a bit farther away, and we are already tied up down here. And like I remember I was saying before, that right in the nick of time, someone comes through. Well, then we got contact from the Belize Association in Florida. I hope that's the right thing I'm saying, but the diaspora people in Florida. And they said, well, we want to make a contribution. We chose the Salvation Army to reach out to others to help for the COVID. And so these two things linked together.
Yeah.
We received the contribution from them. We purchased the items, so we helped stimulate some funds locally in the business economy, and we went down. Group of us that are pastors, we went down to Douglas and shared some stuff there with 60 families. And but going back to the other first part of the there are some people who are normally employed in a job in the tourism sector, travel agency, this kind of thing. They were doing okay, but the closure, the cruise ships and this stuff, suddenly now they were struggling. And you know, with the airport not reopening and cruise stuff, I was led to contact some of them, and I discovered, yes, they're struggling. They're very appreciative of the help. So people now that would normally have been surviving, keeping their head above the water, were struggling. So we were able to assist because other companies contacted us to say, well, we believe that you can find the people, but we don't want you to give to the regular. We want you to target some people that definitely, and some families that definitely will be in need. And these companies actually package some, I would say, family size things. So I was very careful to assess first and not just go to the regular people, you know, in Belize City that we would always be helping with. We actually went out first to seek out persons that were definitely impacted, so that we could joyfully and comfortably give these items.
If people would like to make donations, what would you ask for the most that Belizeans are much more in need of, and where can they go to drop those off?
Well, we did a soft support for those who were affected in the flooding. We didn't go ourselves, but we partnered through agencies such as Rotary Club. Belize Rotary was working with the BDF and others to go up there in the valley areas and so to distribute the clothing. So I passed the clothes to the Rotary Club and Rotary so that they would go out and share these clothing. So that was from the flooding. But here now, people can make monetary contributions. Let me start with that part. People can make monetary contributions to our Belize Bank account. I will call the number, but I always put it again. But it's 12986 00101 2001. It's a long number.
Well, yeah, we're gonna ask them to call you and get that information, or we'll post it on our Facebook as well. And I think it's critical, that question, because people want to help. I think no matter how your circumstances have changed, you know that there are many in this country that are struggling. And Major, you really put it into perspective for us. The Salvation Army has helped or does provide assistance year round, and especially at Christmas, that's when we really see you publicly come out and either ask for donations, but also you have things like your Christmas lunches and your toy drives. How are those, are you going to do anything similar to that to try to get some of the children most in need some toys? How did you manage to pull that one off in the pandemic?
Well, we normally would partner with Bravo Motors, and this year we realized, and we spoke to Bravo, we all agreed that we couldn't do the 600 children dinner because and our functions. Yeah. So we have postponed that outreach to the children until early in the new year when the schools reopen them face to face. We are trying to see how because we definitely still want to do something for children early in the new year, but school is closed, so we couldn't really reach out to find them. They're all over the place. So 600. So but we will do that between January and February. But we have some the churches who have the children that they deal with at the Christmas time, not just in Belize City but out, and they will be distributing toys. I know, I see the toys right over there in the room. So I know they're prepared and ready to go in the distribution. So we will be reaching out to children in the new year. We can't see them now, but we didn't want to leave them out. Yeah. So we'll do it. Can I say, as you mentioned, that we are there throughout the year. Yeah. And it talked to me last night. I want to share especially because the online and the new normal. We're going to be trying to restart again this campaign that we have called Friends of the Salvation Army. Years ago, we had this, and business houses and other people committed to giving to us on a monthly basis or bi-monthly basis, quarterly, financially to our cause, because we are there throughout the year, and people come with varied needs every week. And so some companies would say, okay, I have some stuff like food stuff and that, I will send you the Salvation Army. And then people come to us and we can put together a small package. It's not like a full thing, but we can give them a little something to last them a few days. But we need to partner with people for that. Now, so we have two businesses that contribute to our primary school for the feeding program on a monthly basis. But it's something that I know is not Christmas, but it's something that hit me last night. I wanted to mention that through here we do a family tracing service, and there's a COVID story, and all because the Salvation Army is in 132 countries in the world. We have a network. So if you can't find a relative that you haven't seen for some time, you can give us as much information as we can, and we send it to international headquarters, and they try to find the last place where it's seen, find a Salvation Army location there, and that person will go and investigate, see if they can try to track down the person. So I was there in my office, and then suddenly I received an email from my headquarters in Jamaica telling me a Belizean person in London, in England, was trying to track down the relatives in Belize, hoping that they would be able to find out if they're well and if they'll be able to get some assistance. And and I was able to find the people within. As soon as I get the email, within 2 hours I found them, and I turned up at the house. This was before we had the curfew, right? So I turned up. The curfew was like 10 o'clock. Okay. I turned up at the house at 9:30, and in the night, so the people looking out, and the people were saying, "Well, who are you?" And I said, "Well, I could tell them their names, and because of the information that we got from the person from England, and so shocked that this person contacted the army, and I found them.
Oh wow!
Within 2 hours,
yeah,
we were to share some stuff because they had lost their jobs due to the COVID. You see, so we are, a lot of people don't know all this little behind the scenes story.
Yeah.
But there's a regular thing for us every week, to be honest. And when now you ask me these questions, it suddenly exposes and remind me again of the varied work and impact that we do throughout, not just Belize, but throughout the world on a daily basis without even thinking, to be honest. Without thinking. Is our slogan is, with heart to God, which means, we worship Him and we have church and our love and compassion comes from Him, but heart to man, which means with whatever is in our heart, we will try our best to reach. Now, we can't do it all on our own. So depend heavily on the contributions of the public. So even if you bring some used clothing, gently used clothing there, trust me, there's a person that is going to gladly receive it. Cooking items, plates, glasses, we receive all these things. The only thing I haven't received so far since I come here is a boat and a car. Somebody want to give me a door.
Good one. But Major, just before we conclude, can you once again share with us the bank account number, those numbers, so we could get that up on our social media network, please?
Yes, Belize Bank, 12986 00101 20001. I know it by heart now. I've been giving it.
I know, but you want to do it one more time, but slow. We're trying to write this down.
Yeah.
That's my Barbadian accent. See? 12986 00101 20001. And I would just like to thank the Belizean public for allowing us to serve them yet another year.
Yeah.
I want to thank those who support, who have such a deep respect for the Salvation Army. I feel very humble every time the accolades that people give us. I just hope that we can continue to be at that same standard and be able to reach out to help those who are in need as much as we can. And I know 2020 was supposed to be great, but it was great in a different way. And we don't know what's happening in 2021, but as we look to God and move forward, I encourage everyone to stay safe. Let's just keep seeing how we can make a positive impact, no matter what size it may be, to the lives of others. And in that way, we will be blessed as we give, even if it's a smile along the way. We're wearing masks now, we can't hardly see it, but let's try to find a way that people can see positive even behind the mask.
Yes, absolutely. And once again, there we go. We have the account number up so people can be able to make monetary donations. That is always helpful because then you can get exactly what families need, but people can also drop off items to the Salvation Army. And of course, you help a wide array of people and families, and not just in Belize City. Major, we know the Salvation Army works hard, and of course, if you can't go to the bank or make an online deposit, you can always just find that kettle and drop what you can in there. It can definitely help. I do have one final question, and I know because it is a part of our Christmas tradition. What happens with caroling? Are you guys going to move online?
I was thinking about that because we try to do it by sister.
And I know you love your music too.
So we may actually go live on Facebook and do a piece of that during this week. We try to go to our kettle spots this afternoon. But if we get too busy, we don't know, because today is hamper distribution, but it's not the regular distribution. We partner with Publix and we're giving out food vouchers at the cost of the hamper. So and we're staggering it so that to work on the social distance. I forgot to mention that. So thanks to Public, and they are partnered with Tyson also in in San Ignacio.
Cool.
Fantastic, fantastic. All right, we'll let you get back to that call because maybe that's somebody who wants to donate, and we don't want you to lose that opportunity. Major, thank you so much, and thank you for the work and that you do and the team that you have there at Salvation Army.
Thank you.
Merry Christmas, and of course, stay safe.
Thank you. Thank you.
All right. Great conversations, like we mentioned, Marlene. So I'll tell you what, we're going to take a break, and when we come back, we're going to top things off with how to make your traditional Christmas white cake. That's when we come back. Stay with us.
Our families, businesses, institutions, and the communities that surround us. Then by giving businesses the power to grow, entrepreneurs the ability to expand, and by giving our families the right to own something. The Belize Bank gives you the power to build a nation, our nation. Stronger together. The Belize Bank. Our country. Your bank.
It's a fact that your credit lasts longer when using Smart. During these times, we're all trying to find ways to cut costs and save the little resources we have. With Smart, it's easy to do that. It's a fact that with Smart, your credit lasts longer. You can call Smart to Smart and Smart to Digi using your promo credit, while with the other guy, you can only call OnNet, Digi, or BTL numbers. What does this mean? You get to call any national number using your promo credit. Your promo credit is free, so that call is also free. Know your facts. Don't be tricked by the other guy. Be smart and save your dollars.
changes that 2020 has brought upon us, this holiday season is unlike any other. But despite all those changes, this year has taught us that being apart doesn't mean we can't stay connected. And that's why here at Channel 5, we adapted to keep you connected with relevant and reliable information and entertainment, as we've done for the past 29 years. And so, as we move into the new year with new norms, we promise to continue being here for you through it all. From our family here at Channel 5 to yours, we wish you health, peace, and happiness this season and beyond. Merry Christmas and Happy New Year.
If it continues the way it is going right now, you would be surprised to see what will happen in the next 10, 15 years. We might have nothing left. And you know what? The Guatemala and they could go back home. Where do we have to go? This is our home. We have nowhere to go. So we need some help.
All right, welcome back,
morning.
welcome back. Good morning. And this is our final segment for the morning, actually. How to make your traditional white Christmas cake. Woo! I can't wait. Miss Jenny Heredia is in with us. She's a baker. Miss Jenny, good morning.
Good morning. Hi. I am happy to share with everyone the recipe for my white nice fruit cake.
Ooh. Okay, Jenny. And it sounds like you are ready to bake.
Okay, I use 2 pounds of white sugar. What I do now, when we don't straining, I do that before. With 2 pounds sugar, 2 pounds of white sugar.
Okay.
2 pounds of baby hour flour or purity. I use purity, but the purity is scarce by the place where I go. So the baby hour is good for it working good.
Okay.
1 pound of blue bonnet butter.
Okay.
Evaporated milk, 1 tin.
Okay.
Baking powder. White vanilla, white rum, and the secret, the wine, 6 eggs.
Okay. Wow.
Okay, I will start to do it now. Use the sugar, already straining.
Okay.
Beat this and the butter for 3 minutes.
Okay. So you're gonna use the entire thing of butter?
You have to use the whole pound.
Okay, because I'm looking closely because I want to make mine.
Hey, make sure you buy from me. Okay, I beat this for 3 minutes until the butter and the sugar will get made.
Okay. All right. So 3 minutes to mix that up?
To cream the butter and sugar.
2 pound sugar, 1 pound honey butter. Then you already mix up the sugar and the butter. Add 6 eggs.
6 eggs.
The whole egg I use.
Okay. So you don't separate the white from the yolk?
No. Put the whole one.
Okay.
So Jenny, how long you been making cakes?
Like 20 years now.
What? And we hear you have a famous white cake.
Yes, I do delivery cake for Kikaker, PG, and San Pedro, K2.
Okay.
I send him by Tropic Air if someone is wanted for the island. It's no matter how far they we send it by the plane.
Okay. And how have the orders been for this Christmas?
Excuse me?
How has the business been going for this Christmas?
And baby, I have a many loser this year. Remember my husband, he passed away about months ago. But he the one introduced me as a business.
Okay.
Fruit cake.
Oh, wow. All right. So something to remember by. So a lot of people have been ordering their cakes so far?
Yes. I have 5 customers already.
Well, yeah, we're seeing how many cakes you already made. You have been busy.
Wow, my goodness, that's a lot. That's a lot.
Jenny, what is the...
Already put the egg, pour the sugar and the butter, then the 6 eggs. Now the small spoon I use 3. 1, 2, 3. Then add it with the flour and the milk, with the vanilla and the rum.
All right, your serum, so everybody look up.
Wait, but you said white vanilla? Yeah, I don't think Jenny can hear us over the mixer.
Yeah, that's
Jenny?
mixer.
Jenny?
Yes, my love?
I was saying, is it white vanilla that you're using?
White vanilla, yes, and the white rum.
Okay.
I pour it in ale because we call this one we call it pong cake. Some people call it pong cake or white cake. So I put the whole
tin of evaporated milk.
Yes.
Okay.
Plus the white rum
Oui.
and the white vanilla.
All right. I don't smell it, Jen.
I know.
You don't smell it,
I don't smell it.
Woo! Say when you taste it.
So who do you have as your cameraman today? Your camera person?
The what?
Who's holding the camera?
Yes.
Oh.
Who is that?
Right now, I barely hear you because I'm a mixer.
Okay. All right, let me ask you now, in between. Who's holding the camera for you?
Who holding the my sister.
Oh, your sister.
Hola,
Good morning, sister.
Good morning. I have my niece by the side too, and my grandkids.
Oh, that's so nice.
Do the cake.
That's what I was going to ask. Are they your helpers too? They help you make the cake? Or they just eat it? Hi, good morning. Oh, you make cakes too?
Yeah.
Okay. Hi, good morning. What's your name? Hi. Oh, they're adorable. Jenny, they're so lucky.
Yes, love.
They're very lucky. When I was their age, my mom didn't have a mixer. We had to use hands.
You used to use the hand, yes.
That's it. Yes, thank God for this. I forget the recipe. I use 2 cups or the fruit mix.
All right.
When I ready with the cake, we added the 2 when I already finished, when I beat the flour, so we put the two cups of fruits.
Okay.
I have this one by side because when I put the 2 pounds here, I have to be careful too. But when I finish put the flour here, so when I leave it on the top on the cake.
Okay.
When the cake cooks, it comes like this. See the fruit?
Yes. Yes, we have one in front of us too.
Y la fruta está dentro de la lechera. The fruit is inside because I already put the 2 cups of fruit inside. So now, already birthday butter, I put the fruit. Now the time is on for with the cake, 2 pounds.
2 pounds. Oh wow! So you put you weigh the cake to know how much is going in.
You have to, yes.
Yeah.
Sometimes it go 2 ounces more, but this is not mine. Like this one, it got 2 ounces.
Okay.
When I finish do that,
how much cake does that batter make?
They give me like about you suppose you have to give me like about 4 round cake.
4 cakes.
Okay.
So
now that you have the batter there, are you preheating your oven, and to how much degrees?
100 degrees for 25 minutes. Aquí, mama.
Okay.
Conmigo, mama.
Oh wow.
And you sprinkle the fruit on top. Get that into that oven.
Yes.
Like this for 25 minutes. Then, when they finish cook, I wait for 1 hour and a half to get cold.
Oh, okay.
When it cold, so I will use Irish wine. I have one here already.
Okay.
When this don't cook, it don't cold, so I added the wine.
Ooh, and that just soaks right into the cake.
Yes, and the white cake is ready already. Just I need the coffee.
Yeah.
We have the coffee and we have the cake
yes,
here.
we got both of them right now.
Jenny.
Merry Christmas and everyone. And then this when done, bring mama, give me baby with the cover.
Oh my goodness, it's beautiful, Jen.
Yeah.
All right.
Yeah.
I don't have white ready. I have the black one
and
ready.
Do black too. Jenny.
The white cannot wait. Yes.
All right, Jenny. So tell you what we're gonna do, because we've got one of your finished products right here, right now.
Okay.
Yes.
So we are going to see it here on set and taste it too. But in the meantime, can people still order cakes from you?
Yes.
Okay.
You can sell for me if you want any. So I sell pupusas too. So I available by the Boulevard, Central American Boulevard, Gymnast Street, and the Central American Boulevard. And I have the cake ready. My number is 668-2441 or 635-2213.
Okay.
All right.
3 size of cake. Round, medium, I call it. This is 1.5 pounds, and the small.
Okay.
Oh, and the price for the cakes?
This is $15, $20, and the round one $40.
Oh, okay.
White and black, the same price.
Okay. Reasonable. We love it.
Okay,
Yes.
so corner of Gibnut Street and Central American.
Yes. Yes.
You have your pupusa stand and you have the cakes there as well.
I have pupusas and the nice stock jalapeno peppers too.
Oh.
Yes.
Wow.
Monday to Saturday, except this Friday because we busy here.
Because it's Christmas. Oh, look at the stuffed pepper there too.
Yeah, you got
Oh
them
my
there.
goodness. Now, Jenny, you have to come back and you're going to teach us pupusas next.
Yes, still I do my peppers.
Well.
All right, so we got the cake here to try.
All right, Jen. We're about to cut a slice of cake to try.
Perfect. Thank you.
All right.
Thank you very much, and God bless you.
Thank you too, Jenny.
You too, Jen.
You and
your
you and your family enjoy the Christmas, and thank you for sharing your recipe with us.
Thank you, baby. Okay.
All right. Bye. There is Jenny Heredia, hard-working baker there. Clearly has a lot of orders that she has to fulfill, but you can still get a cake from Jenny.
Yes.
You can call her. We have the number up on the screen. And make that order, or you can go to her pupusa stand and you can pick up one of the cakes. There's a small, the medium, and the big round one like what we have here. And I mean, I wanted a slice, but this will do, John. That will do, right?
It's a taste. So I tell you what, we need to take a break, but just before we go, this is the moment of truth for Jenny's cake. All right, Jen. So we're about to taste. All right, so here we go. Oh my goodness. Ruby, ruby, ruby.
Tastes like Christmas.
Tastes like Christmas indeed. All the fruits, nice. It's moist, extremely moist. This is what Christmas tastes like. And Jenny had her number up there. If you want to taste what we're tasting, you give her a buzz. She's at the corner of Central American Boulevard and Gibnut Street, and you could enjoy what we've got here right now enjoying. That's our morning hour, all right? That's the way it is. So I'll tell you what we're going to do. We're going to take our final break, and when we come back, we will be wrapping things up.
The virus that causes COVID-19 may be spreading in our community. People might have the disease even if they have no symptoms at all, even when they look healthy. Because the virus needs us to spread from one person to another, we can stop it from infecting others if we practice physical distancing. That means stay at least 6 feet away from other persons. Don't shake hands or exchange hugs. Do not gather in groups. Stay home if government officials tell you to do so. Use social media or telephone to communicate. Avoid crowded and enclosed spaces. Work from home if you can. Stay home if you are sick, except to get medical care. Avoid close contact with sick people. Don't visit anyone who's sick in quarantine or in isolation. Give them a call instead. Help keep Belize safe.
In these challenging times, the one thing that is certain is that the Belize Bank Limited is here for you. There is nothing more important than your health and safety, and we continue to make every effort to make banking safer for you. Our staff is working around the clock to make sure you can do your banking conveniently 24/7 using our mobile banking app and online banking and keeping ATMs up and running. We value your relationship with us and are here to provide the support you need. First responders are also out there 24/7. Thank you, healthcare workers, security forces, firefighters, caregivers. You are all appreciated. Stay safe. We will get through this together. The Belize Bank, our country, your bank.
Have a holly jolly Christmas this December with NextGen. Contact us today to sign up for free service installation or reconnection and receive 1 month free on your acquired service. Celebrate the spirit of the season by entering our grand raffle. This month, new and existing customers can enter a chance to win a 40-inch smart TV or up to 3 months free bundled service with a Debo 3. Visit our office for a chance to win today. Our raffle will be drawn live on the national channel. From our NextGen family to yours, we wish you peace and joy throughout the Christmas season. NextGen, powered by Central TV and Internet.
Smart got you this December with the We Kinda Christmas promotion. Starting December 4th, you can avoid the rush and be safe while visiting our showrooms to get these one-of-a-kind deals.
Devices start as low as $70 with the Evo Star Mobile. Other devices like the Nokia 2V for just $165, the Motorola E6 for only $235, and Samsung A51 for $675. Check this out. The first 10 persons to purchase any of our iPhone 7s get 50% off that device. Each device comes with 50 SMS, $10 promo credit, plus 2 gigabytes of data, all for free.
Looking for tablets? Then take advantage of the Amazon Kindle 8-inch for $155. Or get a Samsung Tab A10.
All phones come with a starter pack, free SMS, credit and data, plus an extra Christmas treat of 2 gigabytes data, a package valued at over $27 for free.
Now that's we kind of prices. And you can only get them at Smart.
We're back.
Just like that, we're back, and we have come to the end of our show for today. We got things started, of course, with a conversation with Dr. Hidalgo, and he was breaking down to us the new COVID variant that was found in England. And, you know, very important conversations. And one of the things that struck me the most, Marlene, is he continues to say what we need to do is to be socially distant, try not to be close to each other, and try to keep your distance, wear your mask, wash your hands. These things are what we're supposed to do.
Of course, of course. And I think that, you know, what I appreciate about Dr. Hidalgo joining us this morning is that we're all in this together. This is a new virus. Let's not forget that. It's just about a year ago that it was detected in the world for the first time. And scientists have been working to understand it, to learn to treat it, to try to vaccinate and build a vaccination against it. And so information just comes, I know, at a rapid pace. And it's important that we take the time to understand it and to put it into perspective. And he really helped us with that. So we do know that viruses mutate all the time. We know that the coronavirus, this strain of coronavirus, the SARS-CoV-2, has mutated several times. What's unique about the one that everyone is talking about in England is that it has been found to be easier to transmit. In other words, it's easier for you to give it to other people and for you to catch it. Mm-hmm. And that is concerning. It is not linked to more severe symptoms, but it is concerning if more people are getting it. Yeah. So that particular variant of SARS-CoV-2, which is what they call the virus, that particular variant is already detected in other countries. Yeah. And so all it reminds us is that we have to be careful no matter what. You know, we don't know the specifics of the strains of SARS-CoV-2 that we have in our country, but we just have to constantly be thinking, what are we doing to reduce our exposure and potentially reduce the spread that we may be giving to other people as well. And we have to stay conscious of that as we go through our last-minute Christmas preparations, and especially as we head into this Christmas week.
Definitely. I think what's important to note as well, Marlene, that we continue to be informed. Whenever it comes, especially in situations like this one, we need to be informed. So what you could do is that you could always watch that segment back on our various platforms right here on Channel 5.
It repeats right after the show, actually.
So it repeats afterwards. And you could always check out the social media platforms to watch again, to try and understand what Dr. Hidalgo shared with us this morning. And that was a great conversation. We also want to say a big thank you to the folks of the Salvation Army. Marlene, for years, they've been doing their best and trying to continue to spread the love throughout the country by helping in any way, shape, or form they can. So we want to say a big thank you to Major Jonathan Kellman for being with us this morning.
You know, the Salvation Army does a lot of work, and we only talk to them around this time of year. We wanted to make sure we got in this conversation because we know that they do help a lot of families. Major put a lot of things into perspective for us.
He did.
In looking at, we know families are out there struggling. We know a lot of people have lost jobs, and they're seeing it. They're seeing new families come to them asking for support of all kinds. And so as we head into the Christmas, let's not forget that this is the season where we tend to be it's a season for giving,
Yeah.
and we're giving to loved ones. But let's not forget that there are many people out there who are still struggling. You can donate clothes. You can donate food. You can donate household items. You can donate. He said just about anything they will take it, and they will find someone who needs that specific item and ensure they get it. Of course, monetary support is always helpful because they can purchase exactly what people need at this time. And there's the bank account number, which we'll share on our social media platforms. And also, look out for the kettles. They are at the major stores. You hear them jingling in the background.
Yeah.
Make sure you find it and just drop something in.
Drop something.
I know it feels like that money is extremely tight for all of us, but it doesn't mean that you can't spare something just to help those who have nothing.
Marlene, this morning we read a wonderful eye-opener, and the eye-opener speaks to exactly what we're talking about now. You see these kettles out there, even, look, 5 cents and 5 cents makes 10 cents, and 10 cents might just be the cost of exactly what somebody needs right now. So help, it's the thought that counts.
Yeah.
So you see these kettles out there, put something in it, and let's try to help each other as we try to get out of this tough time that we're facing at this point. And we also want to say a big thank you as well to Miss Jenny.
Yeah.
Jenny Heredia, the baker.
Jenny,
Yes.
Jenny winning the award for most enthusiastic guest so far. It's hard. I always tell people it's really hard to have
Love
energy
her.
early in the morning and to do things, but she was just ready
on
to
there.
go.
Yeah,
Jenny, the cake was delicious. The fact that our plates are empty right now says enough. And we want to thank you for sharing your
Thank
secrets
you.
with us about how to make that delicious white fruit cake.
Mhm.
And of course, as we noted earlier, you can call her to order your cakes, or you can go to her pupusa stand on Central American Boulevard, and she has them there ready to go.
Ready,
15,
ready,
20, and 40.
I think 40. Yeah. And one of the greatest thing about it, though, is that Jenny will reach you anywhere you are in this country. She does her shipping out. So if you're in San Pedro, you're in PG, and you want cakes from Jenny, of course, you could do that. You just hit her up. Her number is also going to be on our social media platforms. And again, you could rewatch the show so you know exactly how to, what to, when to, and try to get in contact with Jenny. Marlene, it was an excellent time, but we've got to go.
Well, I do have one thing. I should probably just mention it while I'm here. So tomorrow is Christmas Eve, right?
Yes.
Do you remember, you did Give Me Five? There were people who won shopping sprees, and so there were all these giveaways. We're going to get a look tomorrow at the people who went out on these shopping sprees. That's the experience everybody's wanted to see, right? Going into a store, picking up anything you want, and you don't have to pay the bills. We get to see that tomorrow.
Yeah.
But we introduced the burrata in Give Me Five, and guess what? The burrata is extending to Open Your Eyes. We have a show that is packed with giveaways for the Christmas season. But in order to win, you got to tune in. You got to participate. So we're giving you notice ahead of time. Set that alarm. Don't miss the show. We're going to have a wonderful Christmas special. No, John, you can come if you want to, you know. And we just have a socially distant party, but it is going to be a great celebration. The Christmas season is upon us, and we really wanted to make this one special, so don't miss it.
I'll tell you what, at Channel 5, we never done. That's what we do. We're so thankful to have you.
We're done with the show, though.
Yeah, for today. For today. But you know what? It's like we're not done because you could always rewatch on social media. Thank you to you. You're always with us. We're so thankful. If you've got any questions, any concerns, you could drop us a line at oye@channel5belize.com.
You can also drop me a line at Marlene_OYE at channel5belize.com. Find us on Facebook at Open Your Eyes BZ.
Or you could find us on Instagram at OYE Belize.
And remember to tune in tomorrow morning on Christmas Eve as
You open your eyes.
to start your morning
Hi,
right.
Marlene, you did that to me.
Start your
Christmas
right.
Look, I'll tell you what, we're going to join you again tomorrow morning. It's going to be a great packed show, completely fun because it's Christmas Eve. So make sure that you join us again tomorrow. Merry Christmas, Belize. And Merry Christmas to you, Mar.
And we'll see you soon. Stay safe, everyone.
Open Your Eyes was brought to you by the Belize Bank. Our country, your bank.